This leaflet is designed to help you and your relative or carer gain a better understanding of your injury, operation and recovery. It has been produced by the therapies team who will be responsible for guiding you through your rehabilitation programme. It is essential to remember that you have an active role in your own rehabilitation, both with and without the presence of a therapist. During your stay, if you and your relatives have any questions, please do not hesitate to ask a member of the team. So what is the operation for? The rotator cuff is a group of muscles which hold the shoulder joint in the correct position whilst facilitating movement. These muscles can become damaged due to wear and tear or following a trauma such as a fall. This can cause reduced movement, loss of strength and pain. This procedure is indicated for the treatment of partial or full thickness biceps tendon tears, severe biceps tendon degradation or tendinopathy, or biceps instability linked to a rotator cuff tear. A biceps tenodesis involves detaching the long head of biceps from its attachment in the shoulder and reattaching it to the humerus bone just below the shoulder. If conservative management via physiotherapy and exercises have not reduced your symptoms, an operation may be needed. The aim is to repair the damaged tendon and tendons so pain is reduced and you can regain your strength and movement so that you can return to normal activities. However, surgery is not always advised and it may not improve your symptoms so that you're completely pain-free. What are the risks? In general, the risks of any operation relate to the anaesthesia and the procedure itself. In most cases, you will have a general anaesthetic combined with local anaesthesia, which may be injected in or around the shoulder or around the nerves that supply the region. You'll be able to discuss this with the anaesthetist before surgery, and he or she will be able to identify the best method for you. Arthroscopic rotator cuff repairs are commonly performed and is generally a safe procedure. Before suggesting the operation, your doctor will have considered that the benefits of the procedure outweigh the disadvantages. However, to make an informed decision and give your consent, you will need to be aware of the possible side effects and risks or complications. Infection. There is around a 1% chance you may develop an infection. Signs of an infection include worsening pain, redness, swelling of the area, discharge from the wound, and if the area becomes hot to touch. Pain. It is usually painful for the first few weeks after surgery. It is recommended that you take pain medication regularly to begin with to keep the pain under control. If you require further medication, please visit your general practitioner or GP. You may find ice packs over the area helpful. Use a pack of frozen peas, placing a towel between your skin and the ice pack. Until it is healed, also use a plastic bag to protect the wound from getting wet whilst washing or icing. Leave on for 10 to 15 minutes at a time, and this can be repeated several times a day. Bleeding. This is rarely an issue as this is a keyhole procedure. Nerve injury affects less than 1 out of every 100 patients. Blood clot. This is known as thrombosis and affects less than 1 out of every 100 patients. Re-tear. This can occur in up to 40 out of every 100 patients treated. However, this often does not cause recurrent symptoms. Stiffness of the shoulder. This affects 1 to 2 patients out of every 100 treated, but it is rarely permanent and usually improves over a 3 to 6 month period. How can I prepare? Smoking. If you smoke, you must try to stop or cut down as much as you can, as this will increase your risk of infection and delay your healing. Food prep and cooking. Make sure you have completed a food shop prior to surgery and have prepared some meals, as this will make things easier. Freezing some meals or stocking up on ready meals is a good idea, as food preparation may be difficult post-operatively. Going home. Make sure you have arranged your journey home. You will need someone to collect you from day surgery and take you home. What happens during an arthroscopic repair? On your day of admission, you will be seen by a doctor from the surgical team who will mark the site of the surgery and ask you to sign the consent form. The anaesthetist will also review your fitness for surgery and finalise the planned anaesthetic regime. You will then proceed to the operating theatre to undergo the operation. During your surgery, you are generally sat up in a beach chair type position. The surgeon then introduces the camera into your shoulder and watches the images on a TV screen. Photos are generally taken of the findings. The surgery involves looking at the tendon tear via the arthroscope and using sutures to repair it. These are special bone anchors used to stitch the tendon back to the bone. The extent of the repair required is directly related to the size of the original tear. The length of the operation will depend on the number of tendons involved. After surgery. Rotator cuff repairs with or without a long head of biceps tenodesis have a protocol created by the orthopaedic surgeons. This guides the therapist to know what a patient can do without putting the operation at risk. You will be seen by a physiotherapist prior to discharge who will give you exercises to complete after your operation. You should complete these until you attend your outpatient physiotherapy appointment. This appointment may be carried out virtually. The aim is to get you home on the same day as your procedure. Nurses will ensure you have eaten, the wound is okay, and your pain is under control. Dressing and wound care. After your surgery, you will be seen by the Community Orthopaedic Project in Essex or COPE team who will review the wound, remove any stitches, and progress your exercises as appropriate. If you do not live within their catchment area, you will be referred to the relevant local services. Be careful when washing not to use soap or rub over the area. This will cause the dressing to peel off. Clinic review. You will be reviewed by your surgeon around 2 weeks after your operation. This may be carried out virtually. Outpatient physiotherapy. We will arrange your outpatient appointment at the trust or clinic closest to where you live. Your first appointment is likely to be 2 weeks after surgery. This appointment may be carried out virtually. The physiotherapist will progress your exercises as per protocol and assist you in your recovery. You will be required to attend a few physiotherapy appointments and continue your exercises regularly between sessions. Will I have a sling? You will be advised to wear a sling for 4 to 6 weeks after the surgery. Your sling rests your arm, protects the injury, and helps reduce any pain. When wearing the sling, ensure your forearm is well supported and do not allow your hand to be lower than your elbow, as demonstrated in the picture below. You may remove your sling for exercises and personal care only. It must remain on for all other activities, including sleeping and walking. Sleeping. Lying on your back or on the opposite side will be most comfortable. A pillow underneath the elbow can be used for additional support. Another alternative is to try sleeping sitting up with pillow support. Personal care. When washing, you may remove the sling if you ensure your arm is well supported under the elbow and kept close to the body. Alternatively, keeping the sling on, lean forward to complete a strip wash. Loose clothing is usually easiest to put on. When getting dressed, dress the operated arm first. When getting undressed, the operated arm comes out last. When can I return to work, driving and sport? This will be guided by the physiotherapist and surgeon and will depend on the type of work and activities you do. Usually, you can return to non-contact sports after 4 to 6 months and to contact sports around 9 months. You will need to inform your car insurance company that you have had surgery, as they may not cover any claims during your recovery period. Will I get a medical certificate? Medical certificates will be provided on discharge if your recovery is likely to mean you will need to have some time off work. These will be issued for up to 2 weeks. If you require another certificate after this, you will need to contact your general practitioner. Exercises to be completed until further physiotherapy guidance. Important information. Due to the nature of your surgery, which has involved the bicep tendon, you must not actively bend your elbow or turn your palm up and down until advised by your surgeon or physiotherapist. You can only move the elbow passively, as in fully supported by the non-operative arm. All exercises should be performed with you sat comfortably with your arms relaxed and hands in your lap. Neck movements. Look up and then down. Repeat this 5 times. Turn the head to one side and then to the other side. Repeat 5 times. Tilt your head to one side and then the other. Repeat this 5 times. Scapular setting. Keeping your arms relaxed with your hands in your lap and your elbow by your side, squeeze your shoulder blades together and down. Hold for 3 seconds and relax. Repeat 5 times. Passive elbow movements. Fully support your operated arm with your unoperated arm. Whilst completing these exercises, ensure to keep your elbow in front of your body. Support your operated arm with the opposite hand. Bend your elbow and hold for 3 seconds. Straighten your elbow and hold for 3 seconds. Repeat this 10 times. Wrist and hand movements. Start by resting your arm on a table or armrest. Remember to keep your elbow tucked into the side of your body. Move your wrist up and down. Repeat this 10 times. Make a fist and spread your fingers. Repeat this 10 times. Please find listed below a selection of useful contact numbers. Thank you.